Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about light microscopy, which is part of the IBMS Specialist Portfolio in Cellular Pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, supporting evidence ideas and some helpful tips that can make your portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the subsection. Knowledge requirement is what it is expected of you to know and understand to demonstrate your knowledge is at the specialist level. Think about what knowledge you had as a Band 5 BMS. How would that differ to the knowledge as a Band 6 BMS? That specialist level of knowledge would allow you to troubleshoot, problem solve, verify, validate, help others and maintain high-quality service. Let's have a look at the first knowledge requirement, which is for you to know the principles and application of light microscopy in clinical diagnostic procedures. What is light microscopy? How does light microscopy work? What is the application of light microscopy in clinical setting? Consider illumination, magnification, image formation, working parts of microscope like light source, condenser, diaphragm, objective, eyepiece, or stage, specialized techniques like bright field, dark field, phase contrast, differential interference contrast, fluorescence, confocal, or polarized. Also consider applications for routine diagnosis, IHC, FISH, screening, intraoperative assessment of F/S, digital pathology, education. The second knowledge requirement is for you to know the microscopic recognition of normal histological tissue and some key features of pathological tissues. Can you microscopically recognize histological tissues? What are the microscopic key features of major organs? Consider the tissue architecture, different tissue types like ileal, connective or muscle, features of major organs like heart, brain, liver, or kidney, orderly arrangement and functional patterns. What are the key microscopic features of pathological tissues? Consider cellular changes like size and shape, nucleus to cytoplasm ratio, mitosis, tissue architecture, the fibrosis, inflammation, necrosis, neoplasia, scarring, metaplasia, abnormal cellularity, structure and composition or increased proliferation. Competence requirement is basically a combination of knowledge, skills, and experience one needs to perform a job to a satisfactory standard and level. Your chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this section. Let's explore the first competence requirement, which is for you to set up a light microscope for color illumination. What is color illumination? How would you set up a light microscope for color illumination? Consider the key steps like focus, magnification, field diaphragm, centering, your training and competence. The second competence requirement is for you to identify normal tissue, cellular appearances under the microscope and be able to recognize commonly occurring pathological features. What are the main histological tissues you can identify microscopically? What are their key features for identification? Consider tissue-specific features, organ-specific features like kidney and presence of gloms, liver and presence of lobules, portal triad and central vein, thyroid and presence of colloid, lung and presence of alveoli, breast and presence of ducts and lobules and so on. What are the key pathological features seen microscopically? Consider cellular changes like size, shape, nucleus to cytoplasm ratio, mitosis, tissue architecture, presence of fibrosis, inflammation, necrosis, neoplasia, scarring, metaplasia, abnormal cellularity, structure and composition or increased proliferation. The third competence requirement is for you to recognize special stains on normal tissue types, controls. Can you recognize types of special stains used to stain histological tissue? Consider demonstration methods for carbohydrates, lipids, pigments, minerals, infectious agents, and extracellular proteins, microscopic examination of stained slides, demonstration method used and the target element or structures they highlight, your training and competence. The fourth competence requirement is for you to recognize common staining patterns of normal tissues using immunocytochemistry. What are the common staining patterns of various IHC markers? Consider microscopic examination of stained slides, demonstration method used and the target element they highlight, your training and competence. Also consider primary patterns like nuclear, cytoplasmic or membranous staining, tissue type pattern like epithelial, connective, neural or lymphoid tissues. Each section also contains reflective statement which is asking you, the candidate, to summarize your role in the laboratory in the context with each section. When you complete all the subsections within this section, you will be required to write a reflective statement. You also need to write a personal reflection on your training and why you chose your evidence. To prepare for that, write a smaller reflective statement for each subsection. What is your role in context of this subsection within the laboratory? What does your evidence demonstrate? Also write a smaller justification as to why you chose your evidence for this subsection. Also write what was your training like when it comes to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier at the end of the section. Each subsection also has evidence of achievement. This is a part where your training officer signs you off as competent and fit to practice as a BMS at the specialist level. Training officer will confirm that you can work in accordance with local SOPs relevant to this section. They will also confirm that you have answered questions set by them to test knowledge and skills relevant to this section. And they will confirm that your chosen evidence demonstrates your competence relevant to this section. You will need to be signed off as competent by internal assessor for this section. This can be your training officer, senior BMS overseeing this section, or a training lead. Questions should be set by the training officer. They need to be based around the knowledge requirements, relevant for each subsection. They should allow the candidate to demonstrate their understanding in each subsection. The questions should be specific and relevant to the candidate's in-house practice. They should also allow the candidate to demonstrate their specialist knowledge. If you would like to see specific example questions, please have a look at the video for trainers. Link will be included in the video description. These are some ideas for supportive evidence you will have to submit to demonstrate your competence in this area. Some more ideas for supportive evidence to demonstrate your competence in this area. These are some resources you might find helpful. I would also like to share with you some helpful tips that can make your portfolio look really good. Try to present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs or even videos, if you can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Try to make it a little bit more interesting to the reader, which will be your training officer and eventually the assessor. Try to put yourself in their shoes. How would you like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video. I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also try to use various types of evidence, not just one type, like case studies for each subsection. You could use experiments, case studies, annotated results, annotated photographs of you performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation and verification as comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Try to bring in your personality. Think about the ways you like to learn best. If you like experimenting, perform experiments. Like troubleshooting, perform troubleshooting. Choose something that demonstrates your understanding, knowledge, skills, and how you apply this in your practice. And one more thing, keep the competence requirements in mind when you selecting your evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirement for this section. And I hope you also have a better idea what evidence you can choose to demonstrate your competence. And my final take-home message? Keep those requirements in mind when answering questions and selecting your evidence. Bye for now.